fed up of being called obese? Do you want to get away from lifestyle diseases like diabetes, heart attack, stroke, blood pressure? Here is a solution to all your search. A famous Italian doctor known internationally, Dr. Prof.Cappello, has come up with a new diet system called KEN, in short for Ketogenic Enteral Nutrition, which makes you look younger, smarter, painlessly and permanently. Dr. Cappello is here with us now and will explain it. Good morning, Dr. Cappello. We know that obesity has become a problem due to rapid change in modern lifestyle. How dangerous is obesity?
Yes, obesity is spreading everywhere in the world. I have the experience of Italian obesity. We are to 20% of obese in our population. But here in India, it's growing very fastly. And in America, it reached the 33% of population. So it is worse than cancer, and we have to do something to stop it, to develop. It is not only the problem that obesity is, it's an aesthetical problem. Obesity especially is a danger for your health. Because now we know that obesity will generate the so-called metabolic disease, which is caused by the fat. If you for many years you bring a large amount of fat with yourself, we will get this metabolic disease which will cause two very important problems. One is the diabetes, and the other is the hypertension, two very severe diseases which will endanger your life, And we know that reducing fat, reducing obesity, we will reduce the spreading also of diabetes and hypertension. Here in India, the percent of people who are obese is not so big. But Indian people have a genetical problem, so that if they get obese, they put the fat on the abdomen. That's typical of Indian people. Now we know that having the fat on the abdomen, it's much. If you have the fat on the abdomen, more easily you will get diabetes and hypertension. So it is very important that also in India we make a very good campaign against obesity.
Doctor, how does one become obese?
It's so simple. People get obesity just because they eat more than they burn. Each person has an equilibrium between the calories that he intakes and the calories who are lost. If you lose the less calories that you intake, you'll get fat. You get fat. You don't need one day, you need weeks, But it is easy to get fat. Now, the problem of Italy, but also all the world, is that we change our style of life. We have cars, we have elevators, we have the television who keep us sitting all the afternoon, all the evenings. So we move much less than 100 years ago. But our style of eating, it has remained the same. We are always using the same size of dishes, They were not reduced. It's 200, 300 years. Well, we are using the same dishes and we fill them with a food that is too much now for us. This way, our world will go to obesity, very rapidly.
We see that childhood obesity is also on the rise. Is this a dangerous trend?
Also in Italy, they like very
chubby kids,
chubby kids. They're smiling, everybody is. But we know now that for a child to be fat is very
Could you
bad.
tell us how your diet is different from others?
Normally what they take is just hypocaloric diets, which are effective, but the effect is too slow. So at the end, people don't use them. And this is why obesity is spreading. What we are proposing is a new, very effective treatment, which is fast. You lose 1 kilo per day, you know. This way people get involved with treatment. And many people who stop doing diets, they start doing them because they feel that they can win obesity.
How did Ken come about, and how long have you been using it for?
I'm a surgeon, but I'm expert of artificial nutrition. You know, artificial nutrition was born in the world in 1970, and I was the first using artificial nutrition in Italy in 1974. And from that time, I've been treating people with artificial nutrition. That is this tube, you know. You introduce this small tube in the nose of the patient. Through this tube, you introduce a nutritional solution so you can nourish him. It's so easy, you know. We use it for people who cannot eat, you know. And just now I have 400 patients who are living with artificial. They cannot eat, absolutely, because they have diseases that doesn't allow them to eat normally. So I nourish them with this tube. 31 of them are on this treatment for more than 10 years, you know. But generally this treatment it is used for patients who are not obese because they cannot eat, so their weight is reducing very rapidly. In 1985, we start using a very special artificial nutrition solution, which was only of protein. It was done for nourished patient, but obtained on the same time that the weight goes down. So you have an obese patient with a surgical complication, you introduce the tube, you start with this solution, he is cared of his disease, and at the same time he loses weight, so everything is perfect. Now, 6 years ago, I had a young woman who had a post-operative complication. She had been operated to the colon, and the operation was not good. So she could not start again eating because there was the wound did not close. So I had to put my tube just to make her leave. And with this tube, you obtain also the closure of the wound. So it's perfect, you know. Being that woman obese, I used this protein solution, and in 1 month, she was scared of her problem, and at the same time, she lost 20 kilos. 20 kilos. She had a young daughter who was obese as well. And she asked me, Professor, why don't you put the tube to me as well? And I said, but you don't need artificial nutrition. Yes, but I'm fat. I want to lose my fat, as my mother. But would you introduce a tube on your nose for that? Yes, she said. And then I introduced, you know, there's no danger doing this treatment. Because it's very natural and very easy, and it is not painful to introduce the tube. So I just introduced the tube to this girl, and then she lost 15 kilos, and there was just one patient coming after the other, the friend of the colleague, the friend of the colleague, and in 6 years, we treated 37,000 patients, you know, wow. And they lost 370 tons of weight.
Are the results permanent?
Yes, when you lose muscle, there's very bad diets. The one who let you lose muscles, you know, you're reducing weight as well, that you were losing fat. but the result is completely different because you lose fat, you lose mass on the, on the arm, on your legs, on the thorax, but you don't lose the abdomen, because the abdomen is full of fat. And many diets are wrong diets. If you just don't eat for a few days, you think you are losing weight, but you are losing muscle. If you lose muscles, you'll get your weight again very rapidly, because when you finish your diet, your body has to just regain its muscle mass. So you will eat more and you will gain all the weight you lost.
What happens during a Ken treatment, doctor?
Oh, it is very simple. The patient, they do a 10-day treatment. It starts with the introduction of the tube. That's very easy. And in 1 second, the patient is made swallow the tube. We use a microphone that helps us to introduce in a very smooth way the tube, so they don't feel anything. For 10 minutes they feel something in their throat, like something that you cannot swallow completely, but it's the tube. You will feel it for 10 minutes, then you will feel anything at all, because your body get used to the tube, And you connect this tube with a small portable pump that's allowed a continuous infusion of protein.
Is there any danger of excess protein being consumed during the diet?
This is something many dietitians in Italy criticize about this treatment, because they didn't know the amount of protein we are doing to our patients. They thought that we're doing a hyperproteic protein treatment, and it can be dangerous for your renal function. But the amount of protein, it's absolutely normal. It's the same amount of protein the patient will take with a normal diet. So there's no danger for renal function, for hepatic function, for anything. All patients can do this treatment if they can eat a normal amount of protein. So the only thing is that there's not carbohydrate and no lipids so your body will start melting fat. And the fat makes the ketones, which rise in the blood, and that's the most important thing, because those ketones completely take out the hunger. So for 10 days, the patient doesn't feel anything, doesn't feel the tube, doesn't feel hunger. The only thing he has to do is do a normal life.
Can you carry on with your normal life on the tube?
He can sleep on the tube if he wants. He can walk. We say them continue your work, because if you continue doing your life, you move. If you stay just sitting for 10 days, you will lose less calories and the effect will be lower.
Do you recommend running and exercising during Ken?
We say them move, just walk. They can't run, because if you have not carbohydrates on your diet, you will feel rapidly fatigued, So, but they can walk. They can walk for kilometers. And walking is better because they lose calories. They lose as well, they increase the breathing, and breathing more, you lose ketones with the breath, That's very important. So this is why they lose from 7 to 10% of the initial body weight. So a man of 100 kilo can lose from 7 to 10 kilos. That's a very good reduction of weight.
Doctor, who can take part in Ken?
There were 57,000 patients who did it. And we used till 85 years patient, It works on the same way, because, it is very natural. It is just having proteins, with normal milk proteins. There's nothing dangerous, and it is effective for everyone. It is the same for male and females. generally male patients seems to lose something more, but it is because they are bigger, you know. So the percent
that muscle
they lost, yes, they lost 12 kilos sometime, while a female goes 9 kilos. But it's because you start
the
with
body frame.
the initial body weight is higher. It is pretty the same, and we check all our patients before and after each 10-day treatment, and we do a very simple exam, that is the bioimpedentiometry. It is a very simple exam. It's like doing electrocardiography. You put 2 electrodes, and a small machine will say to you how much fat has the patient. And at the end, we know how much fat has been lost. And the 80% of the weight lost is made of fat. So that means that this treatment is gives you a reduction of weight that is very stable. That's very important. Using your weight, but after 1 week, you come back to its.
Doctor, is the weight lost on the diet sustainable?
We checked the patient after 1 year, and they had gained a medium of 15% of the initial body weight. So it's very good.
How many Ken cycles can one do?
You can do all the cycles you want.
Is there a maximum number of cycles one can do?
Absolutely not, because you know it is a very normal diet. It is only proteins. You can have proteins for all your life. We had patients who did 15, 20, because they were there to lose many kilos. So you need the doctor who decide that you need the treatment. If you need it, the doctor will introduce, or a nurse will introduce the tube on your nose, painful, and then for 10 days your life will change something, because this tube is connected with the pump. It is a portable pump. They give you a bag, a portable bag. You just take on one shoulder on your.
But can you go to work while on Ken?
We say to the patients to continue their life, because the more you move, the more you do.
But what about your sex life, doctor?
It is not affected at all, you know, because you can live a normal life with your tube. We had many women who could not have children, because if you are too fat,
you can't conceive.
You cannot have children, because there's a hormonal situation that impairs your capability of
bearing children, yes.
And they lost fat, and they could, at least 15 women could have children, you know, a child.
What can you eat during the diet?
They cannot have breakfast, no lunch, no dinner. They eat nothing. They can drink water, tea or coffee without sugar, because carbohydrates.
But milk?
No. Carbohydrates and fat are completely banned. If you take the smallest amount, you'll get hungry. That's the problem, because the sugar, the carbohydrates will stimulate the insulin, which is a hormone that makes you hungry, and it stops the melting of your fat. It's very dangerous. So the only thing they should do is just live a normal life without eating anything, but they don't feel at all hunger. And they check each morning their weight, and they feel, they see that they lose, in the first days, they lose 1 kilo per day. That's giving them
moral boost, confidence.
Confidence, and this is why it is very rare.
Can the diet be implemented easily?
All patients are on a home treatment. They go to the office of the doctor to introduce the tube. Then they learn how to use the pump and how to make the treatment. Very easy, you know. And then they go home, and they come back after 10 days, just to make another check of the weight and of the body composition. And then the treatment is stopped. Just that. After 10 days, they can do another treatment if they want.
Is there a risk of respiratory related issues when the tube is inserted?
With this tube, in these 6 years we are using this treatment, we insert at least 100 times tubes, no? And we had never pneumonia of any kind, and we had no problems during the insertion. You could think that introducing this tube can make your nose bleeding, or you can have a damage of your throat. It is impossible because, as you see here, the tube is very soft. I say to my patients that it is like eating spaghetti, you know. So, you know, in Italy, spaghetti is very common, no? And they know that you eat spaghetti and nothing happens because they're eating spaghetti all the time. So this, just swallowing this tube is like eating...
Are there any major complications?
Absolutely not. The only complication you can have is sometimes that a male patient who's making just shaving, he shaves the tube, okay, and then it cuts the tube and you have to change it. That's the only complication. There was a very famous professor of my university who was fat, and they started this treatment, and then he telephoned to me and said, Professor Cappello, you know, I did something very wrong. What? I burned my tube lighting the cigarette. That's the only way, the only times it happened, you know. But you can smoke without any problem.
Can you tell us about the safety of the treatment?
They absolutely safe, and that's a very important thing. Many treatments of obesity are very effective, like surgery, you know. Now there's the bariatric surgery that they reduce your intestine and you lose weight very rapidly, you know. But it is a very dangerous operation. You cannot do the operation. Unhealthy. Yes, and you can't do this treatment just to lose 10, 15, 20 kilos. You have to be very obese, you know, to do that. The tube has no complication at all.
Doctor, is there a minimum weight that a person needs to be to go on Ken?
There's no minimum weight. If you want to lose 5 kilos, you just put the tube. You wait that your scale goes 5 kilos less, and then you take it out. It is then you have to concentrate yourself in maintaining your weight. Many times people who's fat has to understand that you must reduce the amount of food you are eating, because if you don't reduce it in 1 month, in 1 year, or in 10 years, you will get again fat.
Okay. Are pregnant women allowed to be on Ken?
No. Pregnant women, you know, that's a very important moment for a woman to leave, and they cannot use the tube.
Post-pregnancy, it can happen.
Post-pregnancy, if they do lactation, when they are just, the boy is starting eating by himself.
After the breastfeeding phase is over.
He start reducing breastfeeding, then they can do it.
Get into this treatment.
And many times they come because they get fat just during that lactation, so they have to do something to reduce their weight.
Are thyroid patients eligible to be on Ken?
Many fat people, obese people have thyroid problems, and they have to continue their thyroid treatment, and the problem of thyroid doesn't affect at all the results of treatment, which are always the same. Very good.
I have to thank you, doctor, on behalf of all those people out there struggling really hard to lose those extra kilos of weight, and to bring in that ray of hope and the new beginning in all their lives through the painless process of Ken, to lose those extra kilos in such a short span of time. Thank you, doctor. For all you people out there who want to lose weight, you know what to do. Ken is your way. Contact us to know more about our aftercare products. Visit our clinic at Kamaraj Memorial Hall, Tenampet, Chennai, or visit us at www.ivo.com.